Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. Today's question is, what is the association between the meaning in life and borderline personality disorder? Now, when we talk about borderline personality disorder, we're talking about a cluster B personality disorder in the Diagnostic and Statistical Manual. And when we talk about meaning in life, we're talking about a sense of purpose that individuals develop. There's a belief that these two constructs are related, and to answer this question about this relationship, I used a study published in 2017 by Marco and colleagues. So let's first take a look at borderline personality disorder. As I mentioned, this is a cluster B personality disorder, so it's in the same cluster as antisocial, narcissistic, and histrionic personality disorders. We believe the prevalence of borderline personality disorder in the general population is about 1%. And there are a lot of studies with a lot of different prevalence figures, but overall, it seems like 1% is reasonable in terms of a guess. Now, in terms of gender prevalence, here we're not really sure. There are research studies that indicate that the prevalence is about equal between the genders, so roughly the same number of men are affected as women. But most studies indicate that more females would have borderline personality disorder than males. Now, in the Diagnostic and Statistical Manual, the DSM, we see 9 symptom criteria for borderline personality disorder, and 5 have to be met for a diagnosis. So the symptom criteria include frantic efforts to avoid abandonment, unstable relationships, identity disturbance, impulsivity in 2 areas that are potentially self-damaging, suicidal behavior, suicidal gestures, threats, self-harm, affective instability, chronic feelings of emptiness, inappropriate or intense anger or difficulty controlling anger, and paranoid ideation or dissociation. It's estimated that about 10% of individuals with borderline personality disorder will complete suicide, and about 60 to 80% of individuals with this disorder will have non-suicidal self-injury at some point in their life. So now taking a look at this construct of the meaning in life. Now, the meaning in life is something that an individual figures out, a conclusion that they come to, a sense of purpose that they develop. This is different than an overarching existential construct of the meaning of life, although certainly there is an overlap here. But meaning in life is very specific to a person. And we see that this term, meaning in life, also has a number of alternate terms: sense of purpose, goal-directedness, self-actualization, authentic living, to name a few. And we know that with higher levels of meaning in life, so stronger feelings that someone has meaning in their life, we see that this is a protective factor. It reduces, but doesn't eliminate, the risk of suicide. It's also associated with a positive view of life, increased coping skills, and increased life satisfaction. Now, lower levels of meaning in life has been associated with substance use, depression, suicide, hopelessness, emotional dysregulation, antisocial behavior, hostility, aggression, and it's also been associated with having an invalidating environment. So if we look at all these factors that have been associated with a low meaning in life, it makes sense that there could be a connection between borderline personality disorder and meaning in life. So if we look at the results from this particular study, what do we learn about this potential relationship? Well, first, it's important to understand here that the way this study was constructed, there was a group of individuals who had borderline personality disorder and another group of individuals who had at least one mental disorder but no diagnosis for borderline personality disorder. So this was not a comparison between individuals with borderline personality disorder and individuals who had no mental disorder diagnosis. So what we see here in the results is that borderline personality disorder is associated with a lower level of this meaning in life construct. And for individuals with borderline personality disorder, low levels of meaning in life is associated with high levels of emotional dysregulation. We also see here that meaning in life is negatively correlated with what the authors refer to as the main symptoms of borderline personality disorder. This relationship, this negative correlation, is the strongest for the emotional symptoms and it's moderate for the behavioral symptoms of borderline personality disorder. So when we look at this study, there's a few things we don't know. This looks at correlation between constructs, specifically borderline personality disorder and meaning in life. And this is not the same thing as causation. So we don't know if a lower meaning in life leads to borderline personality disorder, if borderline personality disorder leads to low meaning in life, if there's some other factor that we don't know about that explains both of these constructs. So there are a lot of unanswered questions in terms of the relationship. Even still, there are some things we can learn here and some different theories that we can come up with. So one theory would be that therapy in treating borderline personality disorder, at least to some extent, should focus on a sense of purpose. Another way we could look at it would be that the successful treatment of borderline personality disorder symptoms may lead to increased feelings of a meaning in life. But either way, one element does seem to be fairly clear, which is it does seem important to assess meaning in life when treating borderline personality disorder. The two constructs are related, and of course we need more research to figure out exactly what the nature of that relationship is. I hope you found this description of borderline personality disorder and the meaning in life to be interesting. Thanks for watching.